of Communication at UHD, and we are recording this session. So I'm Tony Hong from UHD, Associate Professor of Communication, and I'm here to welcome you as we kick off our Spring 22 Women's Health Lecture Series. We're so fortunate to continue collaborating with the Women's Fund for Health Education and Resilience. Our partnership began in 2017, and it has continued to grow as we've exciting to bring you exciting speakers and industry professionals. So today is no exception. I want to introduce Kayla Rogers from the Women's Fund, who will give a formal introduction and introduce our guest speaker for today.
Thank you, Tony, for introducing me. We are very happy to be continuing this partnership and very excited for our first presentation of the semester today. Like Tony mentioned, my name is Kayla Rogers, and I'm the program supervisor at the Women's Fund. For those of you who are maybe not familiar with the Women's Fund, we are a nonprofit organization here in Houston, and we provide health education for women and girls so that they can be advocates for their health. We do this through focused seminars like today's presentation, as well as curriculum-based presentations and publications. All of our presentations and publications are free of charge. If you're ever interested in learning more about us or receiving any of our publications, you can visit our website, thewomensfund.org, and order copies or download free PDF versions. So throughout the presentation, if you wouldn't mind just keeping yourself muted, at the end, we are going to be doing a question and answer session. So if you want to put those in the chat as those questions pop up, or if you feel more comfortable when we open up the floor for questions, you can definitely unmute yourself to ask your question. But I have the pleasure of introducing our speaker today. Ashley Dedman is a native Houstonian and holds a Bachelor of Science degree in Community Health from Prairie View A&M University. She earned a Master of Public Health from Florida A&M University and is a Certified Health Education Specialist. Ashley has enthusiastically worked in her community as a BRCA2 patient speaker, where she speaks to physicians about the importance of genetic testing in their practices, as well as other healthcare professionals on the importance of screening for family history. She is a cancer research advocate with Houston Methodist Research Institute and MD Anderson, and as an advocate, she works with researchers to ensure high quality research that is sensitive to the priorities of cancer patients. Ashley is a BRCA2 previvor and was a teen caregiver of 2 parents with cancer. During her journey, she authored The Big Discovery, a children's book that facilitates and guides families through a breast cancer diagnosis. Ashley and her journey have been featured speakers on the TED platform, Women's Health Magazine, Fox News, and Radio 1. Ashley is affiliated with numerous organizations and serves on a myriad of professional work groups and committees. She has received awards and recognition for her work in the community and business space. In 2021, she was named 40 Under 40 in Cancer and Greater Houston Women's Chamber of Commerce Women in the Fast Lane of STEAM. In 2019, she was a Houston Business Journal 40 Under 40 awardee. So we are very thrilled to have Ashley here speaking with us today on the generational impact of cancer. And I'm going to go ahead at this point and turn the floor over. Ashley?
Thank you, Kayla, and good afternoon. Can everyone hear me? Am I good, Kayla?
Yes, you're good.
Awesome. First, I would like to thank the Women's Fund and University of Houston downtown for this opportunity to speak. As a former board member and ongoing supporter of the Women's Fund, I believe in the mission to provide Houston area women and girls with the tools they need to advocate for their health. Next slide, please. So today I'm going to talk with you about the generational impact of cancer. I love storytelling, so I'm going to tell you a story of how cancer has impacted my life. As Kayla mentioned, open up the floor for some questions. Next slide. All right, my disclosures, I have a few disclosures. The content shared in my presentation, written and verbal, is not meant or intended to replace the advice of your physician or influence your own personal health decisions. I am not a medical doctor. I am not a genetic counselor. I will not be providing any medical advice. Please refer all medical questions about your health to your physician and medical providers. So a little bit about me before I get into my journey. As Kayla mentioned, I'm an advocate, and I've been an advocate since the day my mother was diagnosed with metastatic breast cancer. And here I have a few organizations that I am affiliated with, that I've learned from, and that are doing great work in the breast cancer and genetic testing space, as well as the cancer research space. And before I go into my journey, I always like to tell my story from being a teenage-year-old caregiver and going into my young adulthood. And so as I begin to share my journey, it's going to definitely be from that lens of me when I was 18 years old, when my mother was diagnosed, and 21 years old when my father was diagnosed. And I'm really going to talk about the mental and emotional and psychosocial impact of this disease, in addition to finding out about my own risk for breast cancer. This may look like gibberish to you. No, it's not a complex equation. No, I'm not a mathematician. This is a very unique code, a code that represents a change in my DNA. To understand this code did three things. It educated, equipped, and empowered me to make informed decisions about my health. I hated her. For the first time in my life, I hated my mother. I wondered, did she love me? Did she care about me? Did she want to see me grow up, get married, and become a wife of my own? My mom cared. I know my mom cared, but my mother forgot. She forgot about her health, because being a wife came first, being a mom came first, work came first, but what should have also come first was her health. Scheduled mammograms and well woman exams got away. And ultimately, she got away. Breast cancer impacted 3 generations of women in my family. My great-grandmother, my grandmother, and the latest was my mother, who was diagnosed with stage 4 or metastatic breast cancer. Over her 4-year journey, this disease tried to strip her of her joy, her faith, her dignity, and her strength. But my mom fought. And although she didn't win her battle earthside, she fought her fight and she kept her faith. I was 21 when my mother passed away. Months later, my father was diagnosed with prostate cancer. And I remember asking myself, what is going on in my family? I knew my family history. Now my mother had just passed away. Now my father was just diagnosed. The question was I next? Was cancer coming for me? I was scared. I had questions and I knew I needed answers. The first thing I had to do was educate myself. So I reached out to my OB, updated her on my family history, and that's when we discussed the next best steps. She told me to come in to her office. She was very adamant about me getting genetic counseling and genetic testing to see if I was high risk for certain cancers. And at the age of 22, my results revealed that I was BRCA2 positive. So what does this mean? Let's take a look and see what I've learned. The questions that I needed to know were, what and how did this impact me? And before I reached it, I recently just shared with you, I shared with my doctor my family history. And that family history, again, consists of a great grandmother who was diagnosed at the age of 65 and 78 with breast cancer. Her primary diagnosis was at the age of 65, and her secondary was at the age of 78. My grandmother was diagnosed, her age was unknown. And at the age of 49, my mother was diagnosed with metastatic cancer. And at the age of 53, my father was diagnosed with prostate cancer with a Gleason score of a 7. So what does having the BRCA genes mean? Let's take a look. BRCA is an abbreviation for breast cancer genes. Everyone has the BRCA1 and the BRCA2 genes. The BRCA genes do not cause cancer, they actually help to prevent cancer. BRCA mutations, which is when you go through genetic testing, which is when you find out if you carry a mutation, they occur when the DNA that makes up the gene becomes damaged in some way. Both men and women can have a BRCA mutation. BRCA mutations can be passed on to children, and BRCA mutations have been known to increase a person's risk of developing breast cancer, ovarian cancer, as well as elevated risk for other cancers. So what does that mean for me? It means I'm high risk for certain cancers. As a BRCA2 mutation carrier, I have up to an 87% risk of developing breast cancer compared to the average woman who is at about a 12 to 13% risk over her lifetime. I also have up to a 63% risk of ovarian cancer, and again, elevated risk for pancreatic cancer and melanoma. Being a BRCA carrier also means you're at a higher risk for prostate cancer, but I don't have a prostate. But I did wonder at what point who I inherited my mutation from. You would assume my mother because of the multiple cases of breast cancer on her side of the family. But then you could also assume my father because he was diagnosed with prostate cancer. And in February of 2020, he actually underwent genetic testing and his results were negative. And so I was able to get that closure that I needed to know that I inherited this mutation from my mother's side of the family. This knowledge changed my life. It equipped me to make informed health decisions. At the age of 22, I began seeing a high-risk oncologist to monitor my breast and ovarian health. She took the time to really get to know me, to understand what my life dreams and my goals were. She knew I wanted to get married. She knew I wanted to have children. And so we began to discuss my risk management options. We discussed hormone therapy that would drastically reduce my risk to about 50%. We discussed increased surveillance, which would aggressively monitor my breast and ovarian health. We also discussed prophylactic or preventative procedures, which would reduce my risk down to a below 1 to 2% residual risk. So at the age of 22, I had my baseline or my first mammogram and transvaginal ultrasound to monitor my breast and ovarian health. Over the next decade, I had them annually in addition to breast MRIs and breast ultrasounds to monitor my health. If abnormal growth were to occur or develop, I knew I would catch it early. I felt confident and empowered by my decision. During those 10 years, I also became a wife and a mom, and I had the opportunity to breastfeed, which was something that was very important to me. But I also saw myself going down the same patterns as I saw my mother. And that was not making my health a priority. I found myself rescheduling and canceling my mammograms and my well woman exams because life got in the way. But this time I knew better. I knew what my risks were for developing breast cancer. So I decided I needed to explore other options. So I reached back out to my high-risk oncologist. I talked with her about a preventative option or preventative procedures. And from there, we discussed and decided that having a double mastectomy or a preventative double mastectomy was the best option for me. And so this now was at the age of 31. And so when I look back on this journey, I know it was the best decision that I made for me and for my family at that point in time in my life. But I was not ready for the emotional and mental impact of this journey. Going into this journey, I really felt like I was losing a piece of who I was as a woman. After surgery, there were a couple of weeks before I went and transferred into my implants, or I had my implants put in, and I started to question my womanhood. I wondered if I was still attractive, if I was still desirable to my husband, if I was still beautiful. And I learned along the way that my breasts don't define who I am. They are a piece of who I am, but it is my strength and my character and my integrity that define who I am as a woman. Losing my mother was the defining moment in my life, and genetic testing was the pivotal moment of my life. It changed the trajectory of the impact of this disease from my past to my present. It established my new standard of care, almost like a blueprint for how I needed to monitor my health moving forward. So when I look back on this disease aggressively attacking 3 generations of women in my family, through genetic testing, my girls and I are aggressively and preemptively able to attack breast cancer. So what I wanted to show you here is now that I know that I carry this mutation, this is now information that I'm going to pass, and I have passed on to my daughters. And so knowing that I carry this mutation, my daughters have a 50-50% chance of inheriting this mutation from me. So what does that education look like and that advocacy look like for my daughters? It looks like educating my daughters on their body awareness and family health history. It looks like educating them and talking to them about my inherited mutation and about what BRCA is and what it means. It also looks like advocating for their monthly self-breast exams and breast awareness. It looks like equipping them with the information and the knowledge about their family history. And it also looks like empowering them to be able to make informed health decisions for when they get older. We all know somebody impacted by cancer, whether it be the patient, the caregiver, or their children. Cancer can have a physical, mental, and emotional impact on the entire family in different times and in different ways. And so I'll leave you with this. No, I didn't hate my mom, but I was 18 years old at the time. And frankly, I felt like life was about me. I felt like nothing can happen to mom. I felt like mom is always going to be here. And we know that that was not the case in my story. But I want you to know, if you or someone you know has a family history of cancer, be empowered to talk about it. Be empowered to learn more. If you or someone you know has been diagnosed with breast cancer or any other cancer, be empowered to learn more so that you can go and advocate for yourself, so that you can do the things that you need to do to lower your risk. And so finally, as I close it out, Kayla, I want you to know those monthly self-exams, breast awareness exams, those are important. Those annual exams, those annual visits to your doctor's office, those are very important. Please remember not to skip out on those exams. Please remember to, if they get scheduled or they get canceled or they need to be rescheduled, please make sure that you make those a priority. And finally, when you're in those offices with your providers, make sure that you answer any questions that they may have, but also that you have your list of questions to ask them. I do have some additional resources here. If you would like more information on genetic counseling and testing, if you would like more information on breast cancer or health disparities or breast disparities in breast cancer, or even risk management options, I do have a few organizations here that can provide you some information. We have the Penn Medicine, the Vassar Center for BRCA. We have the Tiger Lily Foundation. We have Force, Facing Our Risk of Cancer Empowered. We have Susan G. Komen, and also the Wisdom Study. So next week, or the next series, will actually be about the Wisdom Study. So I'm going to stop and talk really briefly about the Wisdom Study. And then we also have a representative from the Wisdom Study here with us today. And I'm going to open the floor during the Q&A session for her to talk a little bit more about the Wisdom Study. But the Wisdom Study works to modernize and improve breast cancer screening, detection, and prevention. It's a study, a personal study that has a risk-based approach to breast cancer screening. It's not a one-size-fits-all. The Wisdom Study helps you to learn if you're high risk for breast cancer, and if so, the ways to reduce your risk. You can enroll and participate online or from home, and that consists of about 1 hour per year. Next slide, please. How do you participate? You enroll and you participate online. Everyone in the study completes an annual breast health questionnaire online. If you've had a mammogram, the Wisdom Study collects the mammogram reports. You'll be alert if you're high risk for breast cancer. And every year you receive a breast screening recommendation. For personalized groups, it consists of a complete saliva-based genetic test kit that's mailed, and you receive personalized screening recommendations on your individual risk based on sending that back. And so, as I shared, we have Stephanie here from the Wisdom Study as we transition into the Q&A session, who can answer more questions about the Wisdom Study, in addition to just share a little bit more in depth about the great work being done at the Wisdom Study.
Hey, did you guys want me to, this is Steph Goodman. Sorry for interrupting, Ashley. Did you want me to give a few words about Wisdom now, or should I just be on the call in case people have questions at the end?
No, you can go ahead now. Go ahead. I think this is the best time, the appropriate time.
Okay, fantastic. Hi, everyone. Thank you so much for welcoming me into the conversation. And Ashley, I just, your story is really, really touching, and I appreciate you sharing such a deeply personal journey with all of us. And what you went through gives me just so much inspiration to keep working toward improving breast cancer care and treatment and prevention. So the Wisdom Study, it's It's a research study that was founded by doctors at the University of California, San Francisco, but the study is now nationwide. We have just over 50,000 women across the country enrolled in the study and participating as part of our wisdom study community. We've got representatives from every state. So we've got women in the study from every state across the United States. The study is enrolling women between the ages of 40 and 74 years old who've never had breast cancer. So this study is looking at ways to improve breast cancer screening. It's looking and working to modernize the current standard of care for screening, which currently there are 7 different sets of clinical guidelines that advise when to start screening, when to stop, and how often to get mammograms. And currently, they're all based on a woman's age. So the current standard of care advises women to start getting mammograms at the age of 40 and to get them annually or every 2 years based on her age. But the wisdom study is suggesting that it's time to say goodbye to the one size fits all approach of annual mammograms and instead use the best of medical technology and the data that we have about ourselves, which is our risk for breast cancer, and analyze that data and then advise women on when to get a mammogram or advanced imaging based on her own individual risk. So we know that a woman's risk is impacted by what you were talking about: family history, hereditary cancers, genetic mutations that can be found and identified in either blood samples or saliva samples, plus lifestyle, how much alcohol you drink, how much sugar you eat, any kind of environmental factors that you've been impacted by, as well as your breast density. And so the wisdom study looks at several risk factors, and then we'll analyze a woman's risk and advise on how often to get screened for a mammogram, as well as whether a woman should be getting MRI screening to catch cancers that can be missed in mammograms. And for women who are found to be at low risk for breast cancer, then we may advise them to get less screening so that they're not being over-screened or over-radiated. So we follow women for a minimum of 5 years, but the only thing that a woman needs to do to participate is complete a questionnaire online once a year. It's about a 20-minute long questionnaire, and it's a pretty low burden for participating, but you can have a big reward of learning your risk for breast cancer and ways to reduce your risk if you're found out that you have high risk for breast cancer. So we're enrolling women through the end of 2022, and we'd love to get the word out as far and wide as possible. So if you know anyone who is interested, who's never had breast cancer and is between the ages of 40 and 74, please visit our website and join today.
Thank you, Stephanie. And I believe the next health lecture series will be about the wisdom study.
Yes, we're going to have some of our top research investigators talking about the wisdom study and what it means to consider a risk-based approach to screening, and how we do what we do and what we're working on so hard to improve breast cancer disparities for women of color. And we'll be talking about the science of that and how we're working to make those changes. And we're looking at, that's probably going to be in late April is when we're going to be talking about that.
Awesome. Thank you.
Thank you so much.
And before we go into the Q&A section, during my journey, going through my preventative double mastectomy, my daughter was 2 years old at the time. And the hardest part of that journey was explaining to my daughter what was happening. It was explaining to her why mommy couldn't pick her up, why mommy couldn't hug her, why mommy couldn't do those things that she was used to me doing. And while I was recovering, I reflected back on some of the many conversations that my mother and I had. And one question I would ask her from time to time was, what has been the hardest part of your journey, Mom? And her response every time was, it was telling you that I had cancer, and it was keeping you updated on what was happening throughout my journey. And so that information with my personal experience, I authored a book called The Big Discovery. And this resource serves as an educational tool to assist families and children in navigating a breast cancer diagnosis. The treatment process is introduced, but is left open so that families can navigate their options and make informed health decisions, because every woman's outcome is different, and every woman's treatment option is different. And so the book is child-centric. It has medically accurate illustrations that illustrate breast self-awareness, clinical exams, a mammogram, biopsies, and those things that a lot of times children may not see, or they may just hear about. And so it helps to really set the stage for families to start the conversation. These are my sources. And if you would like to follow me, this is my Instagram page for my book and for my advocacy platform. And we have made it to question and answer time.
Okay, thank you so much, Ashley, for that presentation. I have known you for a while now, and I definitely learned new things about you and your story. So this was really interesting for me, and I know everyone on the Zoom here today probably feels the same way. I want to say thank you for opening up and sharing as much as you did. I think you mentioned having conversations like this is important. And so I want to thank you for sharing your story with us. We are opening the floor for questions. So if you want to put them in the chat, if you're more comfortable doing that, you can do that. Or if you would like to unmute yourself to ask your question, you can do that as well. We do have a few questions that were sent in a little bit earlier, so I will go ahead and start with those.
And Kayla, I will say, as it pertains to my story, there is no question that is off limits. I am an open book.
Okay, so the first question that we have in the chat here is actually, oh, you already answered it. Okay, your Instagram again. And I'll actually go back to that slide for anyone who's interested there. So a question that was submitted prior to this presentation wants to know your personal belief around the appropriate time to go in for screening. They mentioned that there are several factors that inhibit or kind of keep people from seeking screening, whether it be financial reasons or having to go through insurance or get referrals. But outside of all of those things, they are curious to know what your opinion is about screening and when that should be done.
That's a great question. And so there's guidelines as it relates to screening for BRCA or in other hereditary cancers. There are guidelines in which, or at that age, or at an age that you can get tested. And so I was tested at the age of 21. And, you know, looking back, I have to say, it was a great time, but I wasn't prepared for the information that I had received. It was a great time because I knew very early in my life, and I knew that my health would look different. My standard of care would look different going forward. But also at the time, I was just finishing college. I had just lost my mother. I had just heard about my father's diagnosis. And so it was just a lot of change within a couple of months to a year. And so it was a lot of information at that time. And so aside from that, I believe, and as you said, if those other factors were not, not including those other factors, I always say, if you know of a family history of multiple or rare cancers in your family, if you're hearing around, the holidays or at family reunions that aunts and uncles and parents are being diagnosed, that is so important to get that information to your doctor as soon and as early as possible, because it helps to, again, open you up to explore your options. And so for me, earlier was better because I was able to make an informed health decisions going into my 20s of how I wanted to manage my care. And for me, that was risk management options, that was increased surveillance. And then, of course, as life continued and life changed, and having a family, I went back to explore those other options. And breast cancer is so aggressive. Any type of cancer is aggressive. And depending on what type it is, it depends on a couple of factors as far as age and hereditary risk. And so it's something where if you know you have a family history or if you have a genetic predisposition to it, the earlier is always the best. And so, yes.
Great, thank you. A question popped up here in the chat and it says, during your health journey, did you feel like your doctors did a good job informing and educating you? If not, what would you have liked them to do better?
Hands down, absolutely. I will say my doctors are phenomenal. I've been seeing my high-risk oncologists since I was 21, 22. They are almost like my family. They know me so well. They know that I'm going to overshare and over-communicate when I get into the doctor's office. They know that I'm going to sit down and take time with them. And they reciprocate that with their time. And it's a very good question because, we are in a time where you think about things like medical mistrust and health disparities, especially with Black women and women of color. I was very fortunate for my providers to have really good relationships that include bi-directional collaboration. I will say, going throughout the healthcare system, going to appointments and coming across personnel with scheduling and checking in and, screenings, I have come across people who have told me that I was too young, who told me, oh, you don't have to worry about breast cancer, you're too young or it's too soon, or, even your BRCA2, you still have got a little time. And in addition to that, I also came across individuals as I was navigating throughout the healthcare system who, where I was faced with implicit bias and racism and stereotyping. But I'm very fortunate and blessed to be able to have a healthcare team that understands me. And I think that came with me advocating for myself, for interviewing my doctors, taking the time to get to know my doctors, asking them questions. And that also came with me sometimes walking out of doctors' offices or, letting doctors go or finding new practitioners if I felt that they weren't giving me the equitable and the equitable care that I deserved.
Thank you. That was a really good question. And it makes me kind of want to know a little bit more, have you speak a little bit more on the importance of having a support system. How did you go about finding or creating the support system that you had?
So that's a very good question. So during the 10 years that I did my increased surveillance, no one knew, other than my dad and maybe a few close family members. No one knew that I had this mutation. No one knew that I was getting screenings and my ultrasounds and transvaginal ultrasounds and MRIs. No one knew that I was doing that for about 10 years. But it was when I decided to make the decision to have my preventative double mastectomy that I knew it was time to talk to my friends and kind of become more open about it, because having a surgery like that, it was definitely something that you can't just not talk about. And so it really also took me time to understand that I was angry for about 10 years for what this disease did to my family. I felt that this disease tore my family apart. And so I didn't want to talk about it. I suppressed those feelings. Which I look back on it and I'm like, it wasn't the healthiest thing to do. But I think it was just my time of processing what had happened to my family and what my risks were. And so within those 10 years, not only processing my feelings and my emotions, I became educated, I became equipped, and I was empowered now. And so when I was getting ready for my surgery, I began to talk with my friends and my families. I had my surgery in December of 2016. My birthday is in October. So that October before my surgery, I used my birthday to have a gathering where I shared with my family and friends about my inherited mutation. And I also had a genetic counselor come in and talk to them about family history and the BRCA gene mutations and gene. And then I also shared with them at that time that I was going to be having a preventative surgery to drastically reduce my risk.
So there is a question here that was submitted beforehand again about preventative mastectomies. And it says, how does a person know if they should have one? So how did you make that decision for yourself?
Great question. And again, I'm not a provider, I'm not a medical doctor, but a decision like a preventative mastectomy should definitely be a decision that a woman and her family and her medical team, having all of that information and having information from all three of those dynamics and having that information about if you're a high risk or if you're diagnosed, all of those things play a role in a decision like that. In my case, for a woman who is undiagnosed but carries a mutation, it was knowing my family history. It was knowing my risk. It was talking with my doctor about my risk management options. It was my faith. It was praying about it. It was talking with my family. It was talking with my husband. It was all of those things that went into my decision. It was knowing that I wanted to have children and I wanted to breastfeed. And it was then finding the right time and all of those things. And with all of that information to be able to make the best decision for me.
I think that's a great way to answer that question. Definitely not a decision that you make lightly, but I appreciate you sharing that. So from the chat, we talked a little bit before this last question about support systems. And I'm going to go back to the last slide or the previous slide for this question. So someone asked in the chat, where can husbands, fathers, and men in general get more information on how to be supportive to their wives, family members, etc. during this stressful time and help make the best decision about their health going forward, no matter the result? So I know that you shared these resources. Would any of these be a good place to start, or do you have other recommendations?
So that's a great question. I believe that within these resources, and again, these are just a few that I pulled for this presentation. First and foremost, I definitely believe it's important to make sure you go to credible resources, those .orgs, those organizations that can provide you not only with information, but evidence-based and research-based interventions are so important. And so looking at information on here, as far as support, I believe any of these organizations will provide information on caregivers, and how husbands or partners or spouses can go on to support their loved ones as they are going through their journey. I also see Chris Noble with the Rose on the line. The Rose is a local organization within Houston, in the greater Houston area here in Texas, that provides mammography screening services for women. They have breast navigators, and I know within the Rose, those navigators are not only helping the women, but they're helping their families. And so the Rose is another resource here within our community that is doing great work. And so I'm happy to drop these into the chat. And Chris, if you want to drop information about the Rose in the chat, I know that's definitely another phenomenal resource. And I will also add, whoever asked that question, thank you for that question, because whether you've been diagnosed with a BRCA mutation or you've been diagnosed with breast cancer, not only is that woman or that person or that individual going through that diagnosis, their family, their friends, their community that, that support them, while they're not going through the exact same things, they're going through and they're going through that journey with them in different ways. And so, Kayla, back to your point on support, my father was my mother's caregiver. And during her journey, I was her secondary caregiver, but I was also the caregiver for my father, because my dad needed support. He needed a break. He needed time to take care of his mental health, his emotional health, his physical health. So it takes the entire community to be able to support a person undergoing surgery, undergoing a diagnosis, and going through treatment. And again, these are some resources that can provide you additional information.
Thank you so much for sharing those resources. And Chris put in the chat, the Rose provides mammograms for women with and without insurance if diagnosed. So another really great resource. Something that I did want to mention, I know Stephanie Goodman, if she's still on the chat, because you brought up the wisdom study. And I know that right now their age group is a little bit older for the women that they're recruiting, but they're hoping to start recruiting a little bit younger in maybe a second part of the study. And so she was really interested in speaking with our UHD group to kind of talk about that a little bit. But do you have any thoughts on that, or anything that you would like to say to encourage maybe some of the people on the call today, or for them to speak to women in their lives, the importance of participating in studies like the Wisdom study to push breast cancer research forward?
I could also speak to that. This is Steph Goodman.
I'm glad you're still here.
Yeah, thanks.
Thank you, Stephanie.
And Ashley, let me know if you'd rather jump in too.
No, this is an educational conversation. So no, go ahead.
Thanks. Yeah, so as you were saying, the Wisdom study, we have been, the study's been going since 2016, and we've just got one more year to enroll women. And so this Wisdom, what we're calling it, is like Wisdom 1.0. We can only enroll women between the ages of 40 and 74, and that's because the standard of care right now with the clinical guidelines recommend women to get screened starting at the age of 40. So we're not permitted to reduce that age without having evidence that that screening women younger is more effective, because the evidence we know anecdotally that some women are at much higher risk and they should be screened earlier, but there's no evidence that proves it. And that's why Wisdom is running this study, so that we can try to generate evidence that shows that there are a cohort of women out there that are at higher risk, and that with data we can predict who those people are. So this Wisdom 1.0 is only permitted to enroll women starting at the age of 40. However, we're hoping that with this evidence, we can then roll out Wisdom 2.0, which is we just submitted a massive grant to the National Cancer Institute that we're trying to get funded, that we would begin next year, and it would be Wisdom 2.0, and we would be looking more deeply into who gets what types of cancer, and this is all for the purpose of trying to prove out the importance of being able to screen women younger who are identified as high risk. So participating in studies like this is actually, it's pretty critical. I mean, I love the Wisdom study. I'm a huge proponent of it. Of course, I worked there, but I was a participant before I actually worked for Wisdom. I'm a big supporter of it because I think it's really logical and it makes sense. And not only can you learn whether or not you're at high risk, you're helping to improve the body of knowledge around this topic, so that in the future, hopefully, we can get payers and health plans to cover the cost of genetic testing for women and start screening women who need it at much younger ages. So that's the goal. That's really one of our goals, although we can't currently enroll women younger than 40. There are a few other research studies that are breast cancer risk analysis and screening studies. I just got an email from the National Institute of Health yesterday and mentioning 2 different studies that I'd never heard of. So there's a lot of good research out there right now that's really trying to improve these practices that we know need updating. I mean, clinical guidelines were around breast screening were created 30 years ago when women were just fighting to even be able to get mammograms approved. So we've learned so much in the past 30 years about who gets breast cancer, and that breast cancer isn't just one disease, and that there are lots of different kinds based on hormone receptors, and some are much more aggressive and fatal, and others are take longer to grow and are not as aggressive. So we're doing the work. But please let me know if anyone has any questions. I can do a little search online right now to try to remember the names of those other studies too.
And Stephanie, definitely, I wanted to add, I know you and I have had this conversation, and while I'm not of age to enroll in the Wisdom study, what attracted me to the Wisdom study, and I've shared this with Stephanie, is there are disparities in clinical trials and in research. There's that medical mistrust. And so one thing that attracted me to the Wisdom study was that it was a study that first and foremost, it doesn't have that one size fit all approach. You know, it focuses on each individual woman. It is very informative and educational. It gives you that education along the way. And one thing I like about the study is that should a woman want to remove herself from the study, that she can, you know. And so I've just enjoyed hearing more about the Wisdom study and the great work coming from the Wisdom study. And for me, again, as I shared, it really, it's very pivotal in rebuilding the trust in the community as it relates to breast cancer and guidelines and research and disparities. And so I'm looking forward to what's to come with the Wisdom study.
Thanks, Ashley. Thank you for all that you do.
Well, thank you both so much. Ashley, I again appreciate you for sharing your story, and Stephanie for sharing a little bit about the Wisdom study And with these presentations that we do in the lecture series, sometimes these things may apply to you right now. Sometimes these are things that hopefully you can take with you and have the knowledge later on. But I especially hope that you share the information that you gain through the lecture series presentations that we have with other people in your life. With that being said, if I can find my mouse. With that being said, if you leave here today and you have a question that comes up or you have a comment that you would like to leave us, you can always reach out to the Women's Fund at healtheducator@thewomensfund.org. I usually walk away from presentations and the next day I'm still thinking about them and I come up with a question. So if you are like me and that happens, you can definitely feel free to reach out to us and we will get you an answer or respond to your comments. I've also included a survey link here. We would really appreciate if you would take the time to fill out the survey. It won't take that long, but it provides us with valuable feedback. We want to hear what you liked about the presentation, what you feel we can do better, and also topics that you are interested in hearing about. And I will send out the SurveyMonkey link in a follow-up email as well so that you will have that. And lastly, I have our social media pages here for the Women's Fund. If you're not following us already, I do encourage you to do so. We update our page with health education and information about upcoming events and presentations that we have. And speaking of upcoming events, we have an awareness series on the 16th, so next Wednesday, with Dr. Kara Winkler from UHD. She's going to be speaking about healthy relationships. That presentation is a hybrid and it's up on our website right now, so you can register. You'll have the option of attending virtually or attending in person. And then I know that we mentioned a presentation with the Wisdom Study. That is a part of our Doc Talk series. And so we don't quite have the information up yet, but we are looking to do that in April, late March or early April. So it would be a good idea for you to follow our pages so that you'll be notified when we have that event secured. But we're very much looking forward to both of these upcoming events and hope that you will plan on joining us. Other than that, I want to thank you so much for joining us today, and I hope you have a great rest of your week. Bye.